My name's Sharon. I'm 35 years old. I live in Bermondsey, London. I currently am medically retired and have been for the last 10 years due to ill health and pain. I'm a website moderator. I like video games, films, socialising, eating out. I try to get out as much as possible for my mental well-being. I've been experiencing chronic pain since 1996 when I had a diagnostic procedure following brain surgery that unfortunately went wrong. I suffer from pain on the right side from my lower abdomen right down to my foot. The whole leg, even my backside and into my groin is affected. It's very hard to describe. All I can say is imagine a really sore stomach and apply that pain to the whole of your right leg. 24 hours a day, 7 days a week. It affected everything we take for granted and don't even notice. From wearing shoes like lace-ups, jeans, leggings, having people sat beside me leaning with the slightest pressure on that right side. I couldn't touch my own leg or even rub moisturiser or sun lotion on. I had to sleep with it hanging out of bed. I couldn't cover it up. And in winter, I had to use the lightest sheet I could get, to try and keep it warm. Socks, all supposedly insignificant things like that I couldn't do. And I noticed it had a really big impact on my day-to-day living. Walking was a big problem because you've got this constant nauseating sensation in your leg, and it did make me feel sick. Yeah, my working life, I was constantly distracted by my pain, making little mistakes all the time. Becoming irritable, moody, as anyone would, and other people just didn't understand because I looked fine. That age-old problem. Even travelling on public transport, I couldn't tolerate people near me, which made me obviously seem quite strange to people. Also having to constantly explain yourself and your actions was very tiresome. But sometimes if I was alone, it got so extreme I've tried to overdose. And also I was going to A&E a lot, begging for help. Please help me, I can't cope. And they ultimately told me I was an attention seeker because I looked fine, and they wanted to admit me as a psychiatric patient. So by the grace of God, I eventually found an understanding pain doctor at the Chelsea in Westminster. Over the 6 years while I was suffering with this pain, my doctors tried many treatments, varying from drugs to injections and infusions, but none of these were a long-term answer, and they took away my life really. So what was needed was a long-term solution. After seeing my GP, A&E, general doctors for a good number of years, I was referred to a more specialist pain unit who's specialised in neuropathic pain, and they diagnosed exactly what was happening with me, and that's where I saw light at the end of the tunnel. I was first made aware of spinal cord stimulation at the neuropathic pain management unit I was under, and they suggested it would be a good option for me. I didn't even know it existed, so I was very keen to explore it further. My experience with the stimulator was wonderful. I went to see Dr. Thompson, and he examined me to see if I was a suitable candidate. I must admit I was nervous because this was, to me, it seemed like the last thing I could try to help, and praise God I was suitable. And the next hurdle was the wait for funding, and I was granted that, so I was delighted. And then I came in for the trial, which was a wonderful success. I couldn't believe the instant result for me personally, right away, the moment they turned it on. It was amazing. And then once the trial had ended and I realised it was a great success, I was obviously really keen to have it permanently implanted. And the surgery was no problem. It was no more painful than having your appendix out, I suppose. And every step was explained to me, so I understood everything that was going to be done. And the control unit at the time was really simple to use. I could turn it on and off as required, up or down. So yeah, it was just amazing. It's really simple. I charge myself up once a week. I just attach a little power pack onto a belt and attach it round my waist over the unit, and just sit watching my favourite programme until it beeps and I'm done. The remote control adjust as required, and I can turn it up and down as required, as little or as much as I want. My life now is so much better. That horrendous pain's just almost completely gone. It's about 90% less, which is fantastic. The systems, you don't really notice it's there until you have to charge it up. I can wear clothes again. I can be warm at night in bed. My leg can come under a heavy quilt. I can sit beside my husband and watch television. I don't have to be apart from people. I can use public transport without worrying about people leaning against me. My mobility is improved in the fact that I don't have those awful shockwave pains shooting up my leg as before. So it's made a dramatic difference, and even emotionally, all the turmoil I had and difficulty in my mind's gone as well. So it doesn't just affect you physically, it affects your whole welfare. When I realised how successful this stimulator was, I thought, why haven't they put that in me sooner? Because I understand from my physician that it's been done since the 70s. And the hospital pain unit I was attending was a teaching hospital, and you'd think they'd know about these things. So I was put through all those procedures when all the time I could have been given this, and it would have saved a lot more physical and emotional pain for me. To all patients suffering with chronic pain and not having treatment that helps them, they and their physicians really need to know about this as a treatment option, rather than putting through the turmoil of trying so many procedures and none working. If this is a treatment option, they really need to just go straight for it.
In Sharon's case, she had an emergency angiogram, and in the course of that probably got some femoral nerve damage, which resulted in neuropathic pain. Really very disabling, and in fact Sharon went on to develop a number of other widespread pain syndromes as well, which were being managed in London. As is typical with patients with severe disabling pain, there are quite a lot of features of psychological distress and being unable to cope. And Sharon was lucky enough to have been treated in London for the effects, if you like, of her pain. But she was still really left with quite high intensity pain on really quite a lot of opioid analgesia and other medications, quite sedated with her medications. She desperately needed some other modality of treatment in order to lead a normal life. And you have to remember that she was just in her early 20s then. So we talked about spinal cord stimulation, and I think from my memory she was quick to adapt and adopt this idea.